Today we have three presenters. We're going to start off with Charleston, Jennifer Neville, and she will be going through a presentation about how Get Well integrates patient feedback to improve the veteran patient experience. Next, we will have San Antonio presenter Angela Reed. She will go through how Get Well enhances the oral care education for veterans and using relevant prompts for inpatient veterans. And then lastly, we'll finish up with Tom Blair from Portland, discussing how Get Well improves the veteran experience during wound care by using mindful meditation video content. So we'll go ahead and get started here with Jennifer Neville and Tomica Staley. She is the Client Success Manager over at Charleston. And Jen and Tomica, take it away.
Hey.
Hey.
Sorry, I'm first, Tomica. My name is Jen Neville. I am the Chief Veteran Experience Officer here at Ralph H. Johnson. Just a little bit of a background about kind of how this all started. I was detailed to this role in May of last year, and I was initially tasked with finding where our opportunities were, seeing where we could be a little bit more proactive, because at the time we were very reactive and getting survey data and then trying to follow up with it and do with it that we could. And so when I started to look at everything, that's when I decided to just kind of rebuild the partnership with Get Well Network that we had. There was a different person here before me, and I don't know what was going on before that. But so when it became my turn, we previously had Dennis, who was great. Then Tomica came and joined us, and we've just been a power duo ever since she got here. So Tomica, do you want to do your da-da-da?
No, so I am the Client Success Manager here. I'm super proud to be here. I've heard so much about Charleston. So when I looked up and I got this position, I was very excited. Coming in, they, as she mentioned, they had already been working on the experience for the veterans when they were here. And so teaming up with Get Well in the collaboration, we integrated various prompts and questions to ensure that while the veteran was still here in place, we're getting an understanding of what their time here is like, and if there's anything that needs to be taken care of prior to them leaving. So as Jen mentioned, being proactive instead of reactive. So we have a couple of slides to show you how we've been doing thus far and the success.
All right. So when we started looking at the goal, right, we wanted to look at how we could utilize resources that we already had to be proactive. That way, when our veterans are here and they're trying to make sure that, because inpatient, the goal of inpatient is to prepare the veterans to take care of themselves once they leave here, right? We want to get them well, but we want to prepare them to take care of themselves at home. And so the perception of the care that they receive here is just that perception. So how can we focus on that perception and make them feel that what we're doing here is to help them take care of themselves and help them, get well and understand. Sorry, someone's knocking on my door and I have ADD, so that's very distracting. So we want to try to target the veterans while we're here. So I partnered with Get Well Network so we could find ways that we could be proactive. We started to engage with the staff because one huge thing that we found was that staff didn't really know what we had to offer. Number one, they didn't know all these different resources that we had, and they didn't know how patient experience exactly connected with them and their job, because it just wasn't something that it was put in their day-to-day. So we changed that. We did a ton of education. And then what happened was an increase of staff engagement, and our patient experience metrics improved. There we go. So a little bit about our facility. We are continuously growing. We are one of the fastest growing VAs right now. We serve currently over 80,000 veterans. It's getting close to 90 at that point, so I should probably update that slide. But we offer a ton of services. We have inpatient, outpatient, surgery, mental health, tons of resources for veterans everywhere. We do great outreach. We have other things to support the veterans too. Our homeless program is great. Our women's program is great. We have the Fisher House for families of veterans who are receiving care here for temporarily extended period of time. So we've got a lot of great things going on. Plus, Charleston is absolutely freaking beautiful, so everyone wants to come here. All right, so our program goals overall. We wanted to integrate Get Well Network into as many things as we possibly can, because repetition is something that allows people to get it into their brains and part of their practices. And so Tomica has really taken this and ran with it. She is now integrated into staff huddles, into monthly staff meetings for individual units. For the all over staff meetings, she comes and she's a presenter at my Veteran Experience Committee. And so she's really in there doing one-on-ones with staff, doing the staff meetings overall, just really explaining little things over time. So for example, like 1 month, she might focus on just medication education. So really honing that in. That way it's committed to memory for staff. So it's been really great. And so as we have done that, we found that we can establish people who are quote unquote champions of Get Well Network. So that way they can talk about these things with other staff that maybe we don't catch in the daytime when we're here. So nighttime and even staff. And then we modified our Get Well Network questions that populate based on where our opportunities were inside our surveys. So we get patient experience surveys from Press-Ganey, from SHEP, and from B-Signal. We get PATSRs that we use internally. And so we had a lot of ways to look at data, but not a lot of ways to be proactive. And so we put the questions, almost the exact questions from the survey, into the Get Well Network screens. And that way we can kind of see ahead of time, hey, how would they answer this question if they were answering it now? That way, if we get a negative response, we can get to it right then and there and be super proactive and not give them a reason to give us a low score on the survey. What to do with my hands? So here are the, here's where we felt like we had the most opportunity based on what our survey was showing. And so we have a huge opportunity for discharge information. Again, preparing veterans to take care of themselves once they leave here. The food, do they like their food? Do they like the service? A lot of things. We've done a lot of changes in our food and nutrition service. So we want to capture that so we can see the improvements and see what we're doing is working, because a lot of times you start implementing something to improve the experience, but you have to wait months before you get that data. This gives us opportunity to see it right here and now, and then act on it and say, oh, this wasn't working. We need to shift it a little bit. Nursing communication. How are they like when nurses are coming in to answer your call late, when they're answering your questions, are they listening to you or explaining things in a way that you can understand? That's a huge one. The quiet at night, that's a difficult one. But and I know soon the questions are going to change to restful at night. But now we have new packages that we can give out that have headphones or earplugs or those sound machines that like do that sound white noise or whatever. I know my sound effects are great. Room cleanliness, looking at that's a huge opportunity for our facility. Not that it's dirty, but we find that it's the time that our EMS comes in to do it. So are you satisfied with the room cleanliness? If they say no, then we're asking follow-up questions. So that negative response then goes directly to whoever owns that. So for that room cleanliness, it goes right to our environmental service line chief. And he goes there and he says, okay, well, what could we do different? He captures that data and then he's able to see like, oh, it's actually because they didn't want it cleaned at 7 a.m. or 8 a.m. They want it cleaned in the afternoon. So they just have to shift it a little bit. And so because of that, they've been able to move around some of their practices to better suit the veterans, which is great. And then staff responsiveness, when you put your call aid on, how long does it take? Are you happy with the amount of time it takes for them to come answer it? If you need to use the toilet, do they take you there? All those kind of things. So those are the questions that we use currently. And you can change them at any point. But so here's the questions in our data, right? And so you can see they weren't great. That's how I was able to choose those. Once we started implementing this proactive approach, you can see where it really shifted. I know that there's no Q2 and Q3, but that's because we didn't have any data because we had some mishaps with our the transmission of all the data. So we're missing that. But you can see since we started implementing this improvement measure to be proactive, it's absolutely impacted our patient experience surveys. And so the perception of the veterans is that, yes, we are taking care of their needs, and it's reflecting here. So we still got great opportunities to use Get Well Network to be proactive, but this was just really a start for us to see if this was helpful, and it was. So that's that. And then Tomica.
So here is, this is what we send out for what I collect and I send out for Jen when she's looking at the data and how we're doing. So this is for discharge, the questions that are being asked to ensure that the patient has what they need, or if they have any questions, need anything from a social worker or ride, food help, anything like that. They're answering these questions here. And so as you can see, overall, they're astoundingly answering that they have all the information that they need. That's your yeses. And so if you look at the very top, we're at a 9.4 overall score. So 10 is the highest that we can go. And I feel like it's the use of the system and being able to get the answers right away and being able to help the veteran right away when they're saying that they do have a need is where this is coming from. On the next slide, you see nurse communication. Same thing, they're at a 9.4, and the negative responses being answered within, I think it's what, I want to say it's like less than 10 minutes is what I've found. They're getting their needs met, or if they're missing anything, the nurses are communicating with them right away to let them know, at the very least, I'm working on it. So that's always important. And then the next one is going to be staff responsiveness, how quick everything's coming. So that kind of points to your EMS with, do you need something done right away? Do you want us to change the time that we're coming to clean your room? It's kind of making it so that the veteran is getting their stay curtailed to how they want it while they're here. You want to make the hospital stay as comfortable as possible. And so next slide. And then going forward, we're integrating, we're going to, like Jen mentioned, we're changing up some of the questionings for the quiet at night to restful at night. And then we're going to foster growth with existing champions. We've had, this last session went through, we had an extra 5 champions go through, I believe. And so that helps to filter throughout the floors and throughout the units to kind of teach everybody how to use the system and curtail it to how each unit needs it to be. Next slide. And so right now, that's how we're integrating it, and we've been able to see the changes, and it's really cool to see when we do our monthly numbers and our quarterly numbers, how they match when we get the SHEP numbers, which are coming every 3 months or so. And so it allows us to be more proactive instead of reactive.
The end.
Awesome. Thank you both so much. That was a great presentation. It looks like we don't have any open questions at this time. So if there are any other questions that come up later in the presentation, feel free to hold those until the end, and we'll have a question session after the rest of the presentations are finished. Thank you, Jen. Thank you, Tomica. Now we're going to move into San Antonio. We'll have Angela Reed present on the oral care initiation to reduce the non-ventilator associated hospital-acquired pneumonia. So Angela, take it away.
Hi, good afternoon, everybody. Can you hear me okay?
Yes.
Yes.
Awesome. Thank you. So my name is Angela Reed, and I am a clinical educator for acute care at South Texas Veterans Healthcare System in San Antonio. And I just want to thank you all for the opportunity to share our team's efforts to improve oral care and the collaborative efforts that we've had with our Get Well Client Success Manager, Roger Bermia, who's on the call. Perfect. So the Oral Care Initiative presented an opportunity for us to improve oral care hygiene practices for clinicians and patients in order to reduce hospital-acquired infections. So as a solution, our project team identified that GetWell had features that we could utilize to support this project. So after reviewing these options with our client success manager, Roger, we moved forward with the implementation of oral care patient education, which is titled Healthy Teeth, Healthy You. In conjunction, we also had oral care reminders implemented. And what I wanted to share is that the video that the patients watch, it's less than 2 minutes. It's engaging, it's quick, it's informational. So it's not anything too stressful for them. And we usually combine it with their welcome package. So the outcome of this project was aimed to improve collaboration and communication between staff and the veteran patients on the importance of oral care. About us. So South Texas Veterans Healthcare System serves more than 115,000 veterans within 17 locations. We have one of the largest coverage areas in the VA healthcare system. I specifically work at the Audie L. Murphy Veterans Hospital campus. We are a teaching facility that provides a full range of health services for veterans. Our primary affiliation is with the University of Texas Health Science Center at San Antonio. South Texas was the first VA in Texas to receive the Pathway to Excellence designation, and we did receive our second designation in 23, so I just had to plug that in there. And in addition, we do operate as a high reliability organization, which indicates that South Texas does stand out among other veteran affairs facilities due to our exemplary safety record and commitment to HRO principles. So let's talk about the background for this project. So for most of you, you're probably familiar with the HAPPEN project, which stands for Hospital Acquired Pneumonia Prevention by Engaging Nurses to Provide Oral Care. This HAPPEN project was disseminated across the VA healthcare system to over 155 VA hospitals. So with the HAPPEN initiative, the target is non-ventilator hospital-acquired pneumonia. In most cases, this occurs in the inpatient settings as well as the outpatient areas or CLCs. Hospital-acquired pneumonia is the most common healthcare acquired infection in the United States, and it's associated with a high morbidity, mortality, and healthcare spending. Our hospitalized patients are at risk of aspirating these microorganisms due to risk factors such as immunosuppression and decreased mobility. The lack of national surveillance programs have greatly impacted the hospital's limited visibility to non-ventilator hospital-acquired pneumonia, and this has been due to the difficulty of defining and tracking outcomes, limiting understanding of the burden, and preventability. Research indicates that brushing our teeth 2 to 4 times a day can reduce the risk of developing non-ventilator hospital-acquired pneumonia by 40 to 60%. So the objectives of Project HAPPEN were to engage nursing staff and patients to complete oral care at a minimum of twice a day. So the program goals were identified by our team, and they include the following. Our goal was to increase oral care through patient engagement. Nursing staff are held accountable for offering oral care and providing patient education to reduce bacterial colonization within the oral cavity. By leveraging the use of this technology through Get Well Network, our patient engagement will increase, is our goal. And then we're hoping that the oral care reminders, the education, and our flyers will all work together to bring down our non-ventilator hospital-acquired pneumonia incidents. Then by offering oral care 2 to 4 times a day, the unit will exceed the VH goal of 60% for oral care capture. The VHA goal does acknowledge that we have unit turbulence such as admissions, off-unit procedures, and in some cases patient refusal, which is why we are at that 60% number. But most importantly, we want to minimize the occurrence of hospital-acquired infections through active unit rounding with our nursing staff, reviewing chart audits, and ensuring supplies are readily available. So our project team implemented and deployed ongoing staff educational opportunities. The objectives for our project highlighted the importance of oral care, what supplies we would need, how to provide oral care or denture care for patients that needed assistance, and charting in the patient medical record. Next, we collaborated with our Get Well Client Success Manager to utilize the Get Well Network features, utilizing the patient-facing system with educational content and timely reminders for veterans and patients. veterans and family members. Our staff will continue to drive our veteran patient engagement through these educational videos and daily prompts on their in-room television, encouraging healthy oral care practices. So this is a little bit about our process. Our staff do assign oral care video education through the Get Well Network inpatient solution. This process is completed by selecting methods of how to engage the veteran patient with oral care education. Identifying preferential timing for when the oral care prompts are to be displayed for patients is also helpful. For our project, we chose 8 a.m. and 8 p.m. specifically because the patients, when they wake up and before they go to bed, we have them those gentle reminders to perform oral care. And sharing the physical handout, staff highlight how to prevent pneumonia through proper oral hygiene practices. The team engaged with the Get Well Client Success Manager to implement the oral care design guide. This process included highlighting important education through Healthy Teeth, Healthy You video, designing patient education delivery with key staff. So we included those clinicians, our infection control team, and our quality management teams. Utilize videos and prompts for our veterans, encouraging proper oral hygiene, and offering assistance to patients who may not have the appropriate supplies or the ability to complete the care independently. So these are some of our results. Since launching the Get Well Network enabled features, our oral care documentation increased by 19%. The Audie Murphy VA did not experience a patient with non-ventilator acquired pneumonia for more than 898 days, and this data is from July of 2024. So those are fantastic results. In addition, our team presented this oral care project at our local hospital-wide evidence-based practice fair. We were awarded first place, and we received high accolades from our nurse scientists. We did decide to take it as well to the Academy of Med-Surg Nursing International Conference in September of 24, where we presented to our international audience. That we had people there from all over the country and the world. And then last, within our implementation strategy, we highlighted how the team leveraged technology for in-room education and oral care reminders. So that was a huge part of our project, was using that technology aspect. So looking forward, our goals are to ensure this process is sustainment of education and assistance to encourage proper oral hygiene, will reduce the incidence of non-ventilator associated hospital-acquired pneumonia. Our team monitors sustainment in several ways. We utilize our VHA reports and we complete chart audits. In addition, our leadership team actively review and monitor monthly data with our frontline staff. And then lastly, we implement ongoing unit rounds to keep our veteran patients healthy through proper oral care. And that is the end.
All right. Thank you so much, Angela. That was great. And thank you, Roger, for your help on the Get Well side at San Antonio. It looks like we don't have any questions in the Q&A at this time, but like I said before, if anything comes up, please feel free to send those in the Q&A box and we will address those at the end of the presentation. Thank you, Roger. Thank you, Angela. Now we will move forward into, we'll move forward into our Portland presentation. So we have Thomas Blair from Portland, and Trish Hall is the Client Success Manager for us over there. And Tom, take it away.
Are there a couple slides before that?
It looks like the introduction slide might have been pushed.
That's okay.
Yep, sorry about that. So we'll jump into background here.
Okay. Well, let me introduce myself. My name's Thomas Blair. I'm the I work as part of our education department, or I guess it's organizational development services now. I'm a nurse educator, as working as part of the veterans health education coordinator. I kind of like the work mostly on the inpatient side, and then we have somebody that focuses more on the outpatient side, and then wear a lot of other hats. Portland is a 1A facility in Portland, Oregon, where we have 111 beds and 30 beds in our CLC. And then we have been a magnet facility for the last 8 years. Actually, it's probably almost more than that now, because I think we are up for our renewal pretty soon, which is quite the feat, and takes a lot of work on our staff side. We're also the first 1A facility to implement whole health, or at least on a kind of a macro scale. And what we're really trying to do with this project, and this will kind of tie into the background on this project, is really trying to figure out how we can integrate whole health within our inpatient system, as well as with our outpatients. With outpatients, a lot of it's maybe a little bit more straightforward, because it's a little more easy to capture that, figure out what their goals are, and how we can help have the veterans reach those goals. On the inpatients, we're trying to figure out like other co-therapies or ways we can help them visualize what they want out of their healthcare. So for this project, what we ended up doing was we worked with was actually one of our nurse residents that initially brought this project to us, and they worked with our wound care team to try to figure out a way of developing or having mindfulness as being part of our wound care system, or our wound care treatment options that we have. As everybody knows, wound care can be painful or at least uncomfortable. You have to hold maybe your leg or your arm in some certain position or something like that. So what we were trying to do is figure out a way of integrating these whole health principles in our inpatient wards. So what we ended up doing was utilizing some of the tools that we had through GetWell Network to make this an easy way of being able to access it for staff that are working at the bedside, and being able to implement that. So what we ended up doing, you can actually just go to the next slide. We ended up where we worked with our whole health team to try to create an environment where they would be able to easily implement this. That was the first pushback. I guess pushback is a strong word. The first concern that they had was that they don't have a lot of time. As anybody knows that's worked bedside or worked in a hospital at all, time is something that we just don't have a lot of access to. They need to be able to go and quickly do these treatments and move forward with it. So what they wanted to was have a way of being able to easily reach this and be able to access this information without much friction. They initially started with trying to go through the TV system, going to YouTube. We had some personally made guided meditations that had Oregon-based scenery and was created by one of our local whole health coordinators. And then we wanted to be able to use these videos that were about an hour long or so, that they could just play and then not need to touch anything else because their hands are either dirty or they just didn't want to be able to like distract themselves from what the care that they were providing to be able to do this. So we had had them keep like the same. We wanted to be able to kind of reduce or keep the same amount of medications during it, and kind of work through on a way of helping them distract them from their pain. Next slide. Okay, there we go. Maybe that's what's going on. So yeah, so again, I think we kind of talked about some of these already, but they're frequently, again, procedures are frequently painful or uncomfortable. So again, finding that quick way of being able to access this information. What we ended up doing is having these videos linked in our quick care menu. We had our personal videos that were uploaded to GetWell Network, and then they were provided in our quick care menu. And then we went through and we're able to kind of find ways of being able to implement this and provide this intervention to the patients in a frictionless, easy environment. So again, I think I kind of went through that. So I think I went a little out of order just based on what I had practiced. But yeah, for the process. So what we wanted to do, we had a couple different ways that we were trying to address address this issue? Well, first we thought, okay, what would be a good way that we can measure success with this? We first initially thought pain would be one of the easy ones. You do a pre-pain score and a post-pain score. In kind of a lot longer discussion with our pain committee, they really wanted to kind of move away from being able to use pain as, or not be able to, or move away from pain as a way of measuring success with an intervention. It's both subjective and and it has a lot of other connotations with it. A lot of people are in pain or going to still be in pain afterwards. We didn't think this was going to be a panacea which is going to solve all their pain or anything like that. So we wanted to really try to find a different way. What we did is we found a tool that kind of helps measure distress for veterans, that where they would rate their distress before the intervention and then after the intervention. The wound care team was educated on this tool, and they're educated on how to be able to access the information or the video very quickly and easily, and they were able to move that into to evaluate like the program overall. I'll talk a little bit more on that when I kind of get to the results. It didn't totally work out the way we wanted to, but I think it worked out really. It ended up being very positive in the end. So I guess that's what we're going to do now. So what we have is ultimately what we found was the information from the distress scoring didn't really come to be as valuable as we hoped it would be. We did post interviews with the veterans, so we did the pre-distress, post-distress scoring, and then we ended up doing an after the fact. One day later, we interviewed the veterans to be like, okay, how did you feel like the process went? Was it something valuable? Did you enjoy using guided meditation? And what we found was that a lot of veterans didn't have the same understanding of the distress tool that we tried to use. They were measuring distress over a period of time, or they're just measuring their distress for their hospitalization, or some of them were measuring distress in their personal lives, which is wholly understandable and kind of a failing on our part, where we weren't able to really quantify it in a way that we thought was super valuable. We ended up using a lot of the feedback that we got from the veterans, and the veterans that did opt into this, which was about 60% of the veterans receiving wound care during the 3-month trial that we did it, and we're still doing. So we had really positive feedback from it, but the tool we had, probably not the best tool that we could have used. I think we needed to probably have maybe a different tool or a different way of measuring it, and we needed to probably have some a control group within that as well too. Unfortunately, the denominator was a bit small for being able to have a really good control group within that. So we kind of we're reevaluating it, but I think I found a place that we're at based on the patient feedback and the patient experience regarding that. You go to the next one. Yeah. So what we ended up learning from it, or what are looking forward, we are absolutely going to keep using this tool, where we still use the guided meditation and offer it to every single veteran that receives inpatient wound care. We found the wound care team has said it's very straightforward and very easy for them to use, and it's something that they are absolutely going to use moving forward, and are trying to figure out ways of being able to use guided meditation in outpatient services as well too, where in locations where we don't have Get Well Network, where there's talks about trying to find either more laptops that they can put into their outpatient rooms where they do treatments also. And I think one of the best things about this was a lot of the inpatient nurses became really interested. Frequently, the inpatient nurses will need to help support wound care, either with using a lift to help lift the leg, or doing something else with the patients, or helping kind of prep them for the wound care of making sure that the area is clean and ready for the wound care personnel to come in and do their work. So they were exposed to how this guided meditation works, what the discussion looked like, and how we educated the veterans, and they had some really positive feedback on how that works and how they wanted to integrate it in their own care. And there was a lot more talk about that, and there was other talk about could they use it in other ways of being able to help patients relax at night, or just having something where a veteran's feeling a bit overwhelmed, and maybe we can't have our chaplain services reply right away. It's something that we have at our fingertips that everybody can reach really easily. So ultimately, I think it was overall, very positive experience. I don't think I'm supposed to. Sorry, it was a little bit out of order for me. I think I kind of messed that up, but I think we got it.
Yeah, no, sorry about that, Tom, but thank you so
It's okay.
much. That was a great presentation, and glad to hear that the guided meditation was used by 60% of wound care veterans, and that it is ultimately having a positive result and can be replicated across other areas as well. Thank you so much for the presentation. Thank you, Trish, for your help as well. It looks like we don't have any questions at this time.